So today I want to welcome Dr. Ken Berry to Beyond the Adjustment podcast. Dr. Berry, welcome. Like I said, I've got your information through Amanda Decker. I believe you work with her through the ClearPath Medical facility here in Dickson.
Yes.
And like I said, the purpose of this podcast is just what we're doing is we're just kind of bringing that community together that's related to health and wellness in any aspect of it. So today, I just like you to give us your kind of your origin story, creation story, how you got to this path, and take it over.
Yep. So I'm a family doctor. I've been practicing for almost 23 years now, board certified, licensed. I've been practicing in Midwest Tennessee the entire time. Worked about 10 years in emergency departments around in different communities as well. And the reason I started even looking at nutrition is because I became severely obese and pre-diabetic. And here in Tennessee, these are common sense people.
Yeah.
And so you can't walk into an exam room with your shirt about to pop open at the belly button and proceed to tell them that they need to lose some weight in order to get healthy. That just doesn't work well. And so that was very uncomfortable for me because I'm also a common sense Southerner. And so I had to fix that. And so I initially tried the American Diabetes Association diet and followed it religiously and jogged. And after 3 months, my A1C was worse and I'd gained 3 more pounds. And it was at that point I thought, man, I mean, unless I'm some kind of weird special snowflake, maybe they don't have it exactly right. And so I went down the nutrition rabbit hole, so to speak, and just started reading everything I could get my hands on, not only the mainstream nutrition literature, but also outside the mainstream as well, just trying to figure out what the heck was going on and why I couldn't lose weight following kind of the mainstream advice.
Gotcha. And so that's what's a little bit different between our professions. Obviously, my profession in chiropractic, there's no drugs, no surgery. So we don't have to spend any time on those types of subjects. So we probably spend, oh my gosh, 100 hours through our education process on just strictly on nutrition and supplementation. And I laugh when you said that rabbit hole because I still see nutrition as a rabbit hole. It's like you always want to try the next latest, greatest thing, and you can get off on so many different tangents. But it
Mm-hmm.
really comes down to it, like I teach my patients as well. It's not rocket science. It is not rocket science when you get right down
Exactly.
to it. The human body is designed to have certain essential nutrients, and there's a lot of stuff that we put into our diets we just don't need.
Exactly right. And I love to use the analogy of the cow because I think there is a proper human diet, just like there's a proper cow diet, a proper coyote diet. I think all animals and every other animal on earth knows exactly what they should eat, when they should eat, how much they should eat, and when they should stop eating. Somehow humans, although we're allegedly the smartest species on the planet, we have no damn idea what we should eat and how much and when and every other detail. And so I think you're exactly right. This is not rocket science. This is actually, and so I tended initially when I started this, I was looking at all the latest supplements, all the latest nutrition research, all the latest technology. And the more I read and the more I contemplated about this, I thought, actually, just like the proper cow diet, maybe I should look to the past, the remote past, the distant past. What have humans eaten for the thousands of years we've been on this planet as Homo sapiens sapien? That probably means something. That's probably very important
Maybe
because
like,
I can ask any young child if they're old enough to speak, what do cows eat? They don't hesitate. They just know intuitively. Oh, grass. Exactly. That's right. See how easy that was? And you never has a cow had to take a nutrition class. Never are they surfing the internet looking for a supplement. They don't do any of that, right? And neither do any of the animals in the wild. They just know what to eat. If they're deficient in a vitamin or mineral, they just intuitively know what plant has that or what animal has that, what organ has that, and they go and find that and eat it. And boom, problem solved. They didn't have to buy anything. I think those same principles apply to human beings as well.
yeah, and that's so true. But the downside of that is with the way things have been processed. And the biggest switch that I saw in nutrition as I've watched this over, I've been in practice 34 years. The biggest switch is when all the chemists they went from the cigarette companies to they bought up RJR bought up Nabisco and all these big companies.
Yep.
What were they doing to the cigarettes? They were manipulating the nicotine to make you addicted. Well, guess
Yep.
what they're doing to your food?
Absolutely.
You
Yeah,
know?
and there's a lot of research on this, Doc. There's this thing called the bliss point, and they have figured out how to hit the exact correct ratio of sugar, fat, salt, crunchy, savory, sweet. Like they literally have food engineers and food chemists who make six-figure salaries figuring out exactly how you can make this ultra processed junk food so delicious that you just can't stop eating it. And I think that's a huge part of the obesity epidemic we're seeing all across the world, but mainly in America and especially in Tennessee. You know, Tennessee's one of the fattest states in the union.
Yep.
And so that's why the further you get from modern ultra processed food that's made by $1 billion multinational corporation, the better your health is going to be. And I've told people hundreds of times, I follow a carnivore diet, but I think if somebody wanted to be a vegan, but only unprocessed foods, if they switch from the standard American diet, basically the Kellogg's, Kraft Heinz, and Mondelez diet, Pepsi Cola, Coca Cola diet, if they switch to raw vegan, I think their health would improve, at least for a while. And so you got to stop trusting the big corporations. They're not your friend. They just want to pick your pocket. They just want you to hit that bliss point, get addicted, and keep eating. I don't know if you remember seeing, I think it was back in the 80s, all of the big executives from the tobacco companies, they hauled them in front of Congress and they had them under oath. And every single executive raised their hand and said, I believe that nicotine and cigarettes are not addictive. And they had all the research. They knew the entire time. They had tweaked it for decades,
Right.
making cigarettes just as addictive as they possibly could, but yet they felt fine. And also none of them went to jail for perjury. And so you're exactly right. When it became obvious that the cigarette industry was not the way to keep making billions and billions, they started buying the big food manufacturers because they realized if you've got enough sugar and grains and processed stuff in there, you can make it almost as addictive as cigarettes.
Yeah, and like I said, probably the biggest thing that hit me is I remember reading a research article, and they took the white stuff out of Oreos and they put it in the lab with that, and then they had cocaine. And guess what the rats went with for more? It wasn't the cocaine. They went for the Oreo stuffing, and
Yep.
it triggered the same pathways in the brain when they were doing the MRIs as a cocaine addiction.
Yeah.
And I think that's what a lot of people don't realize. The foods have been engineered against them. And a lot of times it's not necessarily their own fault. A lot of people don't know, but I think, like you said, intuitively, I think people understand you have to eat cleaner. And
Yeah.
I see this so many times when my patients, and you probably have your patients that will travel to Europe, they will go over there. They said, when I was over there, I could drink the red wine. I ate ice cream. I ate the breads. I had zero gut problems.
Yeah, and I've heard that said by many people many times. And honestly, not many of my patients can afford to go to Europe. So, but I have heard that repeated multiple times. I think that the average person who's got a spouse and a kid and a dog and a job and they're just trying to live their life, I think they intuitively know, yeah, I probably shouldn't be eating all this junk food, but I don't think they really understand how important it is. They think, well, I mean, obviously it's in the supermarket, it's on the grocery shelf. So how bad can it really be? I mean, if it were really poison, the government would crack down on it. Or, I mean, these companies, I mean, McDonald's is my friend, Kellogg's is my friend. They, have a Coke and a smile. They want me to be happy. They're not going to poison me. That doesn't even make any sense to the average person. It's only when they really start to think about food. And for many people, they never think about food until they have some kind of health scare. And
Yep.
for me, my health scare was when I got on the scales and weighed 297 pounds because I was living in scrubs. It's got a big drawstring. And so I thought, well, I've gained some weight, but not much. Oh, yeah. And so for many people, it's that chest pain, or they have some gut problem, or the joint problem, or mental health. And then they're like, well, maybe my diet matters. And it's only then that they start to see that, oh, God, yeah, diet's super important. And my heart goes out to all the children whose
Yeah.
parents, they don't know better. They love their kids. They're trying to do the best they can and get by on their salary or their budget.
Yep.
And so they're buying this stuff in bulk. They're buying this cheap ultra processed stuff. I mean, how bad can it really be, right? I mean, if for God's sakes, you can buy it with food stamps, so it can't be too terribly bad, or the federal government would not condone that, correct? Incorrect. So that, yeah, exactly. And so people have to start realizing that you're in this life on your own. You cannot trust the federal government. You cannot trust the billion-dollar corporations. It really, really matters what you feed yourself and your kids, especially because
Yes.
your children are trying to grow a healthy, intelligent brain and a strong, healthy body. You've got to eat the right food for that, or they'll suffer their entire life.
Yeah, and that is so true. And I see that probably passed down more so than genetics. A lot of people think it's genetics. Well, yes, genetics does play a role, as you know, but the role is very, very small, much smaller than what people actually realize. And what gets passed on to the next generation is more so the habits. And
Absolutely.
that's where that really becomes a problem, a very big problem. And like I said, sometimes, I think it was the Super Size Me guy. He spent 30 days basically ruining his health, and I forget it took him a year, 2 years to turn that around, the damage he caused in 30 days. So,
Yep.
like I said, you look at these young children, and you look at it from the start, they're on formula. Well, how do you make more perfect formula than a mother who's nursing? I mean, come on, give me a break.
Yeah. And I think that there just has to be an added layer of honesty from healthcare providers, from dietitians and nutritionists. They've got the mantra fed is best when it comes to children and infants and toddlers. And obviously, we don't want our children starving, of course,
Right.
but we need to be very honest with our patients and say, look, breast milk is the proper food for your infant, for your toddler. There is no formula that comes close to breast milk. Okay. Now, if you don't produce breast milk and you can't find kind of a friend who can be a wet nurse for you,
Correct.
you'll have to supplement with formula. I'm sorry,
Yep.
but not in any way imply. Obviously, we're not trying to put guilt on a mom who can't make breast milk. That's not the goal, but the goal is for her to very clearly understand this is not as good as breast milk. This is not as good. It's not even close. It's not like, oh well, it's a little bit less good. No, it's way less good. And so I don't know, that you quickly you get into this quagmire of, well, you don't want to shame this poor mother, and I obviously don't. No, I want to support mothers, but at the same time, I don't want to mislead them or placate them into thinking, well, this is almost as good. It's probably fine. And so you get into all these social and familial issues that you're like, I'm not trying to make a judgment here. I'm just trying to state a fact.
Yeah, I'm just trying to share the information with you, what's accurate, what's true. So speaking about that, so when you made this transition, how did things change through your practice? Because what I've experienced with a lot of the medical profession, if they go outside the norm of what's acceptable with the drug standards, they get a lot of heat from that.
Oh
Us
yeah.
chiropractors, we're just kind of out here, kind of are doing our own thing. We're not beholden to anybody. But I know a lot of friends who get a lot of pushback or grief from that, from peers and from associations.
Oh yeah. Yeah. Initially, I wasn't recommending this way of eating to any patient. I was just doing it to try to fix my own health. But when it started working, when I went low carb, I started losing weight. My A1C started to improve. When I went keto, then the weight loss really started like gangbusters, and my A1C went back completely to normal. I also noticed other things like my shoulder arthritis, my rosacea, all those things got better as well. And I just thought that was probably anecdotal. Surely that's not related to diet at the time. And so, but my patients, again, those common sense Tennesseans, they would come to see me after they hadn't seen me for 6 months. And they would be like, God, doc, you look great. What are you doing?
Right.
And so I would just tell them I'm eating keto and then eventually carnivore for the last 9 years. And they're like, well, can I try that? And so for my most severe type 2 diabetics, my people who were the most severely obese, just, their life was basically being destroyed by their disease process, I would say, yeah, why don't you try it for 90 days? Then come back and we'll recheck your labs. And so that really it was their, eyes looking at me and seeing the evidence that I was healthier. And then they would naturally, as any human would, ask, what the heck are you doing? Because I want some of that. I would recommend it to those patients. And they would invariably come back with a significant weight loss and a significant improvement in their blood sugars. And as a healthcare provider, when we recommend something, we're always looking for signal,
Sure.
right? For feedback. So if you recommend something to 100 of your patients and they all come back in 6 months or whatever, and they're like, then you're like, okay, well, that's not really helpful then. But if you recommend something to 100 people and they all, literally everyone comes back, they're like, dude, can I keep doing this? This works really well. Now, keep in mind, I was not prescribing them any additional pharmaceuticals. I was not prescribing them any supplements. There was no secret sauce here. It was just cut the carbs,
Yeah.
cut the carbs, cut the carbs. And it worked for every single diabetic and every single person with severe obesity. And I mean, people love that when you recommend something and it's easy to do. You can eat to your full. You don't have to suffer. You don't have to spend money. It just works. And so yeah, that immediately became very, very popular. And it wasn't long before I had people traveling in from other counties and then eventually from other states to discover this magic of what I was recommending to people. And all I was doing was saying, hey, let's eat a proper human diet and cut out the ultra processed junk and all the carbs and all the sugar. And it just works for every single human.
Yeah, and that's kind of bringing back to what we do this podcast. I've always taught and been told that, your health is a jigsaw puzzle. There are so many different pieces, and that's what we're trying to do is bring all these different pieces of the puzzle together. It's not just chiropractic, it's not just medical care, it's not just exercise. You have to have the balance and the coordination of all of those things, and that's kind of what the purpose of is bringing this all together and letting people know what's out there, what's available. So, but
Yeah, absolutely. But I think diet's 80%
100%.
of the battle for the vast majority of people, and then physical exercise, lifestyle, that's 10%,
Yep.
and then everything else is anywhere from a 5% solution down to a 0.0001% solution. And it's so common in Western society, in the US especially, to, if you have any kind of problem, you need to buy something to fix your problem, right?
A lot of
You
good
can't
marketing
just
out there.
fix it. You
A lot
can't
of good
just,
marketing.
and so it's not a Western concept that if you have a problem, maybe you should remove some things from the equation. And invariably, when people suffer from chronic disease, they don't need to add something. They don't need that $80 supplement or that $400 red light unit or
Yeah.
any of the other stuff you can buy out there. They just need to remove
Yeah.
the ultra processed junk. They need to remove the sugar, remove the grains, almost always, remove the vegetable seed oils. And what you're doing is you're giving your body a chance to just heal and return to normal. That's all you're doing. There's nothing magic about keto or carnivore.
No.
You're just removing the slow poisons that led to your chronic disease. That's all you're doing. And then you got to give your body time. As you implied earlier, it's not, it took you decades to get this unhealthy. So you're not going to heal completely in a week or two. It's going to take many months, if not a year or two, before you realize the full benefits of adopting and sticking to a proper human diet.
I can't say it any better. I mean, that is the absolute truth. What I find refreshing is I see there's been a big turnaround probably within the last, I don't know, 2 or 3 years, where I'm seeing more within the medical profession. They're starting to, instead of just saying, hey, this patient's coming in with blood pressure, take this blood pressure medication, they start asking, well, how much coffee you're drinking? Are you smoking? So they are trying to get back to solving, are seeing more doctors solving these problems with changing the lifestyle, because that's
Yep.
what created it. So I don't care how many medications you take, it may control it for a period of time, but there's still an accommodation going on, and the long term of that is not good. I
Yeah,
mean,
when I
we saw
started
that early.
recommending diet, probably 10 years ago, it was very unpopular with all of my colleagues and also with the state medical board, who I got several visits from for recommending dietary solutions, natural lifestyle solutions, kind of natural things. I used to recommend a lot more supplements than I do now currently. They were not in any way impressed with the results I was getting from my patients. In fact, they weren't interested in that at all. They wanted to know why I was marketing this or why I was talking about this Or did you really recommend that this 75-year-old woman eat more bacon? Literally, I got medical board visits because of complaints like that, and wound up getting dinged 2 or 3 times by the medical board, which is fine. Anytime they come to your clinic, as you know, they can everything's fair game at that point. They can look at anything they want to. They can effectively make stuff up if they want to. And
Exactly.
then you're the one who winds up with it on your permanent record. But that's neither here nor there, because I'm not here to make $1 million. I'm here to improve the health of a million people. And so they can do whatever they want. That's fine. But I'm here to help improve people's health as cheaply, as easily, as naturally as I possibly can. And that's still, now I'm stepping on the toes of the pharmaceutical companies and the big supplement companies
Yeah.
by saying, yeah, you don't need any of that crap. You just need to do the following things. And more importantly, stop doing the following things, and your health will improve and it won't cost you a penny. People and patients seem to love that message, but everybody who's in the business to make lots of money, they don't seem to appreciate that message very much at all.
I totally get it. It's funny that you say that with your board. Back in the day when chiropractic came around, chiropractors were going to jail for helping people get better. And that's kind of what you were saying. You're getting punished or reprimanded for getting people healthier. I mean, how absurd is that? It just blows your mind.
Yep, I totally agree. And back then it felt like the end of the world, but now I look back and it's like I'm glad that happened. I feel like that's part of the way that I paid my dues, part of the way that I basically proved that I'm not in this for profit. That's not why I'm here. I'm here to help as many people as I can live the best life possible. And so looking back now, I'm glad all that happened. But man, during the time it was going on, it was no fun whatsoever. But now looking forward, I agree with you. Every day I have a medical student or a training resident physician or a physician who's already in practice, nurse practitioners, physicians, assistants, reach out to me and say, hey, my mom loves you and used your keto or your carnivore to reverse her type 2 diabetes or to reverse her fatty liver or to improve her arthritis or whatever. And I've been looking into it, the physiology, the biochemistry, the molecular biology of this. This makes a lot of sense. And so increasingly, I'm having doctors and other healthcare providers reach out and say, how can I start to implement this in my practice? And then tons of pharmacists, nurses, physical therapists reaching out saying, hey, I can't actually recommend this out loud while I'm on the clock. But what I've done is I've come up with a little business card that I hand to patients. It's got websites, YouTube channels, books they should read. Or a lot of the nurses are like, I can't mention keto or carnivore. I'll get in trouble with the hospital. So
Right.
I've made this little pamphlet that after I've checked all the boxes of stuff I'm officially supposed to tell patients, I'll hand them that pamphlet and say, now, when you get home, look these people up because this will really help you. And so I'm seeing a groundswell of healthcare providers and other health related professionals. They know the truth. They've seen it with their own eyes, either their mom, dad, spouse, uncle, son, their self. And they're like, I can't not tell patients about this. I
Yep.
feel an ethical and a moral obligation to tell every single patient I can about this. I may have to go around the back door to tell them, but
Yeah.
I can't ethically practice whatever branch of medicine I'm practicing and not teach people about a proper human diet.
Yeah, and I think that's fantastic. And that was one thing that came to mind. It's not you're not just helping the people in front of you, but like I said, you're helping so many of your other colleagues, and look how many people they influence.
Yep.
And it's always funny to see this come for a full circle because my parents were going to chiropractors, way back in the late 70s, 80s. Chiropractors, we were quacks. My parents were taking supplements. What are you doing? We had relatives saying, "What wasting your money on supplements?" And I always remember my father, farmer. He says, "Wait a minute." He goes, I supplement every animal on my farm. What's wrong with a little bit of supplementation? He goes, their diet's not perfect because they were confined. He goes, it's
Right.
not going to hurt. It's not going to hurt me. So
Yeah.
to go far
And
off.
that's a great analogy because the average human today is in a confinement feeding operation.
That's a great analogy. I never thought of that,
Think
but
about it. The average person living
right.
in their apartment or their little house, and then they get all of their food basically from the feed company. It's not even food, it's feed for humans. And so, yeah, they probably, if you're eating a standard American diet or many different options, you probably need to take a handful of supplements a day. But I think your father would agree with this. If you turn the cows out and you give them enough acres of actual grass and weeds, you don't have to supplement them at all. They can just go and live their happy cow life and make cow babies and then take a nap. You don't have to do that. But if you've got them in an unnatural environment, feeding them an unnatural diet, then yeah, they're gonna have to need a bunch of supplements. They probably need 2 or 3 pharmaceutical medications just to not be sick all the time. Absolutely.
Yeah, so that's a funny analogy. I'm glad you brought that together because I've never kind of put it together that way. That's
Yeah.
very, very good. So I appreciate your time. Like I said, I maybe we can do this again sometime. I think my audience loves this message, and it dovetails right into my basic training has always been natural first. Everybody gets the connotation that, hey, as a chiropractor, I'm against drugs and surgery. That's not even close to the truth. I'm a realist. If I get run over by a car, don't take me to my buddy, the chiropractor.
Exactly.
Take me to somebody, get me out of a crisis. Now, once I'm out of crisis, now I got to get back to the natural things that create, let my body heal properly. And
Yep.
that's just how I train my patients. I'm never against the medications. I always preach that if you let yourself go to a crisis, you may need that medication to get it back under control, but it doesn't mean you should have to take that for the rest of your life. There's always a
Absolutely.
possibility.
Yeah, absolutely. And I love it that you're on board fighting this battle to make Tennessee healthy again and make America healthy again, and indeed to improve the health of every single human on this beautiful planet Earth. I'm never going to stop fighting, and I suspect you won't either.
No, I guarantee that. It's been 34 years already of fighting, so I'm with you on that mission as well. Again, have a great day. I appreciate so much taking your time to do this, and
Yep.
maybe somewhere down the road we can do this again on a different
Oh,
topic.
absolutely. I love it, Doctor. Thank you very much for having me.
You have a wonderful day.
You've been listening to Beyond the Adjustment, where we have conversations with other health minded professionals to create a healthier community.